is affected and how quickly blood supply is restored to the affected area. A person may have one or more transient ischemic attacks, which are also known as TIAs, before having a stroke. TIAs are often called mini strokes because their symptoms are similar to those of a stroke. The difference between a TIA and a stroke is that TIA symptoms usually disappear within 10 to 20 minutes. However, TIA symptoms can last up to 24 hours. A TIA often occurs months before a stroke occurs, and it's a warning signal that a stroke may soon follow. The first TIA should always be treated as an emergency, even if the symptoms go away after just a few minutes. If you have any of the following symptoms of a stroke, call 911 or other emergency services immediately. These symptoms include any new weakness, numbness, or paralysis in your face, arms, or leg, especially if it's only occurring on one side of your body. Blurred or decreased vision in one or both eyes that does not clear with blinking. New difficulty speaking or understanding simple statements. Sudden, unexplainable, and intense headache that is different from any headache you've had before. Severe dizziness, loss of balance, or loss of coordination, especially if another warning sign is present at the same time. If a symptom was definitely there and then went away after a few minutes, call your doctor immediately. Symptoms that go away in a few minutes may be caused by a TIA. A TIA is a strong sign that a major stroke may soon occur, and it should be treated as an emergency. Chronic bronchitis, emphysema, and other lung conditions are known as chronic obstructive pulmonary disease, or COPD. In emphysema, the walls between many of the air sacs in the lungs are damaged, causing them to lose their shape and become floppy. This damage can also destroy the walls of the air sacs, leading to fewer and larger air sacs instead of many tiny ones. In chronic obstructive bronchitis, the lining of the airways is constantly irritated and inflamed. This causes the lining to thicken. Lots of thick mucus forms in the airways, making it hard to breathe. Most people with COPD have both emphysema and chronic obstructive bronchitis. Thus, the general term COPD is more accurate. COPD is a progressive disease that makes it hard to breathe. Progressive means that the disease gets worse over time. COPD can cause coughing that produces large amounts of mucus, wheezing, shortness of breath, chest tightness, and other symptoms. Cigarette smoking is the leading cause of COPD. Most people who have COPD smoke or they used to smoke. Long-term exposure to other lung irritants, such as air pollution, chemical fumes, or dust, may also contribute to COPD. This disease develops slowly, and symptoms often worsen over time and can limit your ability to do even routine activities. Severe COPD may prevent you from doing even basic activities like walking, cooking, or taking care of yourself. COPD is not passed from person to person, so you can't catch it from someone else. COPD has no cure yet, and doctors don't know how to reverse the damage that occurs to the airways and lungs. However, you can take steps to prevent COPD before it starts. And if you already have COPD, you can take steps to prevent complications and slow the progress of the disease. Believe it or not, exercise is a wonderful way to increase your functional capacity and to prevent complications. So I know exercising is probably one of the last things you want to do if you're suffering from COPD. But even after just a few exercise sessions, you'll really begin to notice a huge difference in your ability to breathe more comfortably, and your quality of life will increase. Talk to your doctor today about appropriate exercise facilities in your area. If you live in Albuquerque, New Mexico, or its surrounding areas, one resource is New Heart Center for Wellness, Fitness, and Cardiac Rehabilitation, and they can be reached at 505-881-8195. So moving on to type 2 diabetes. Type 2 diabetes is the most common type of diabetes. So there's type 1 diabetes and type 2, and type 2 is the most common. It affects somewhere between 90 to 95% of the 12 million individuals diagnosed with diabetes. So type 2 diabetes differs from type 1 in that the pancreas of individuals with type 2 diabetes still produces insulin. So insulin is a molecule produced by the pancreas, and its job is to tell glucose molecules to leave the bloodstream and go into cells so it can be used as energy. However, when someone has type 2 diabetes, the body does not recognize insulin, and the glucose stays in the blood instead of being taken up by other cells of the body to be used for fuel. Only a small amount of glucose is meant to stay in the body, and when a lot of glucose stays in the blood, it begins to damage tissues in the body, such as nerves and small blood vessels in the eyes, kidneys, and heart begin to harden and can lead to a heart attack, a stroke, kidney failure, blindness. You might even need to have your feet or legs amputated, and it can even lead to death. The good news is that type 2 diabetes in most cases is completely preventable. Individuals who have a higher risk for developing this disease than others include those who are obese or overweight, women who have had gestational diabetes when pregnant or delivered a baby weighing 9 pounds or more, individuals with family members who have type 2 diabetes, and people who have metabolic syndrome, which is a cluster of problems that include high cholesterol, high triglycerides, low HDL cholesterol, and high LDL cholesterol, as well as high blood pressure. In addition, older people are more susceptible to developing the disease since aging makes the body less tolerant of sugars. The symptoms of type 2 diabetes vary from person to person, but may include increased thirst, increased hunger, especially after eating, dry mouth, nausea and occasional vomiting, frequent urination, fatigue, blurred vision, numbness or tingling of the hands or feet, frequent infections of the skin or urinary tract. So if you're experiencing any of these symptoms, please contact your healthcare provider for testing. To prevent type 2 diabetes, participate in a healthy lifestyle. So this means maintaining a healthy weight, losing excess weight, eating a healthy diet, including physical activity in your daily routine. And it's recommended that adults participate in 30 minutes or more of moderate to vigorous physical activity on all or most days of the week. If you're a Loveless member and you'd like to speak to someone regarding your diabetes, or you would like more information about diabetes testing, please contact a health coach at 1-800-390-9159. It's free. It's a great resource for Loveless members. And then non-Loveless members as well as Loveless members can go to mypyramid.gov. And at this website you'll find a wide variety of information on nutritious eating habits and physical activity. Again, Loveless members have access to health coaching free of charge at 1-800-390-9159, and mypyramid.gov is great for everyone. So moving on to the flu, in 2004, influenza and pneumonia were the 8th leading cause of death for men in the United States. Influenza is a common viral infection. While a case of the seasonal flu isn't usually serious for otherwise healthy adults, complications of the flu can be deadly, especially for those who have weak immune systems or chronic illnesses. As we saw last year, the H1N1 flu virus was more problematic to young adults. To protect yourself from the flu, get an annual flu vaccine. Some adults incorrectly assume that the vaccines they received as children will protect them for the rest of their lives. And generally this is true, except that some adults were never vaccinated as children. Newer vaccines were not available when some adults were children, and immunity can also begin to fade over time. As we age, we become more susceptible to serious disease caused by common infections. Far too many adults become ill, are disabled, and die each year from a disease that could easily have been prevented by vaccines. Take a few minutes to find out if you are at risk for any of the diseases that can be prevented by immunizations. Some immunizations are vital for most adults, especially senior citizens. Others are appropriate for only certain people. Suicide is another leading men's health risk, and in 2004 it was the 7th leading cause of death among men in the United States. Suicide rates are highest in males who are 75 and older. An important risk for suicide among men is depression. So if you think you may be depressed, consult your doctor. Treatment is available. And if you're a Loveless Health Plan member, you do not need a referral to see a behavioral health specialist like a counselor or psychologist. If you're contemplating suicide, call for emergency medical help or go to the nearest emergency room. You can also call the National Suicide Prevention Line at 1-800-273-TALK. Again, treatment is available. Please seek emergency help if you're contemplating suicide, or go to the nearest emergency room. Some of the things that lead to chronic kidney disease are related to your age and your genetic makeup. However, other risk factors you may be control, such as dietary habits and exercise. You may be able to slow the progression of kidney disease and prevent or delay kidney failure by controlling things that increase your risk for kidney damage, such as high blood pressure, diabetes, eating protein and fats, and certain medications, such as using NSAIDs or certain antibiotics. Again, Loveless members can speak to a personal health coach if they have kidney disease or would like more information about kidney disease. And then moving on to Alzheimer's, memory loss is usually the first sign of Alzheimer's disease. Some of the symptoms include forgetting recently learned information like names and phone numbers, difficulty performing familiar tasks such as cooking a meal, problems with language like forgetting simple words or substituting unusual words, disorientation as to time and place, such as forgetting where you live on your street, and poor or decreased judgment, such as dressing inappropriately for the weather or giving away large sums of money to strangers. There's no proven way to prevent Alzheimer's, but consider taking these steps. Take care of your heart, lower your blood pressure, lower your risk for heart disease, stroke, diabetes, lower your cholesterol, and maintain mental fitness. So practice mental exercises and really try to learn new things. If you are afraid you might be experiencing symptoms of Alzheimer's or you need help coping with a diagnosis of a loved one, please contact the Alzheimer's Association at 1-800-272-3900. So we've covered a lot today on the topics, on the top threats to men's health. So remember, if you have any questions about the presentation, you can email us at healthysteps@loveless.com. The email address is on the screen. And also, please remember to complete the evaluation that you'll be sent at the end of the presentation. Here are a few additional resources we offer to our members. So please visit our website at lovelesshealthplan.com to learn more about these programs, including Healthy Weight, STOP, Your Health Center, Healthy Lifestyle Programs, Health Topics, Choose Healthy, and more of our monthly webinars. Thank you for joining me today, and I hope you learned a lot of information that will help you stay healthy. Have a great day.